Good morning, runners. Dr. Christina, the Picky PT, and this morning I'm going to talk to you about hip internal and external rotation as you're running. So, quick education point. Hip external rotation looks like your whole leg being turned out from the center. Not just your foot, but your whole leg being turned out from the hip. So if you know people who tend to walk or run with their legs turned out, that is hip external rotation. Hip internal rotation is the opposite of that. You might think of it as looking like being pigeon-toed when your whole leg is turned in. But for most of the runners and weightlifters that I work with, we tend to move with our legs in external rotation more than internal rotation. So there is such a thing as working on your hip internal rotation strength to the point that you bring yourself to neutral rather than overcorrecting to pigeon-toe. Most people might sit with their legs turned out. They just kind of fall out because of the overuse of their external rotators over their internal rotators. I have made it a point to work out my internal rotators to equal out the strength that I have in my external rotator. So try it out sitting with your legs out in front of you. If you find that you sit with your legs turned out like this, or it feels like they want to be pulled out, then you might want to consider working on your hip internal rotators. So when you're running and walking, you're not doing so with feet turned out, but you're doing so with your feet in neutral, and you're avoiding having glute pain, back pain, hip pain, and running and walking for as long as possible.